Hi, Peter here, and the video that follows is a very simple routine using I love you. And it's a technique involving touch, working with a carer who might be looking after a loved one who's at the end of their life. And you may not be present as a therapist, maybe at a time of day or the weekend. So the idea is that you're equipping them to communicate through touch their feelings towards their loved one. So you could be demonstrating on one arm while they mirror it on the other side. Alternatively, you could teach a patient's family member and they could teach each other and extend it throughout the family. So the idea is that you stroke down using the hands with the idea that you're actually spelling out, I love you. So these are broad strokes, which is the I. So you can just take one hand over the other, or you can just simply stroke down with the I and then take it into the hand and following each of the fingers down and down to the thumb with the I. And then you can follow with the L. So the idea is you turn the corner and cross the hand. So stroking down and turning across. And you could do this in 3 or 4 or even 6 movements. The repetition is part of the process. So you can come back and do another 3, sliding down and going across. So you're covering quite a wide area. And then you, and you, and you. And the family member could be mirroring it on the other hand while you're demonstrating. Then you can invite them to turn the hand over, or you can gently turn the hand over. And then again, repeat on the other side with gentle strokes down for the I, and the I. And you could then take it down into the fingers with stroking down each digit so that you're doing 5 or 6 movements with the I. And as I say, you can come back and repeat it. So it's a way of remembering the strokes in a very simple way, but it's also conveying feeling. And then we're moving to the L. So you could do this with your thumb and then going across. So the L, and this is a good way of covering a large area, but spelling out the I love you. So taking the L wide and wide and wide. And then the U is simply an upside down U. Yeah. So 1, 2, and 3. So the U's are getting smaller each time. So I'm using my thumb to write the U, very much in text speak. And obviously your carer is repeating the other movements on the other hand. So they're mirroring what you're doing. So again, you're doing this in 3, 4, or 5 movements. So again, you could repeat that with the I, and the I, shifting into the L, and L, covering a wide area. And then the third movement is the U, and the U, and the U. So again, they could be thinking that all the time as they're gently massaging the arm and hands. And if they have a little bit of cream at hand, you could use cream if the skin is dry, or a little bit of grapeseed oil. So say I, and I, taking it down to the digits, I and I, at a speed that's comfortable, and I. And then using that L, and L. And then you, and you, and you. And again, as I say, turning over and repeating the movement. You can do one hand over the other to cover a nice broad area, say, and then stroking down the digit for the I, into the hand and fingers, I, and I, and I. And then doing the L, and L. And in some ways you can bring in the reflexology concept, which is that by working the hands, you're working the whole body. And so you're covering the lung area and the tummy. Okay. And then you have the third movement. So it's just 3 movements. I love you. And you can just sit at the end just for a moment or two before finishing. But if you're working on your own, you do one side, then do the other. But it could be that a family member is doing the other side. And I always find it useful to actually give a laminated sheet with the instructions, focusing on the I, the L, the L, the L, and the U, the U. This is designed for treating yourself, so you'll see the movement is slightly different on the pictures, so you can do it as a self-treatment as well. So this is the guidance for the ILoveU technique with instructions on a printout. Okay. Hopefully that technique will be very useful to you should you be working in a situation, say in a hospice, or maybe in a chemotherapy suite where you're supporting patients and their family member. So thank you very much for watching.